Hey, how's it going, everyone? This is FixerMed. Welcome back to my high yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. This will be part 12 of my multi-part video series giving a broad overview of anatomy for these exams. So without further ado, let's go ahead and get started on today's content. Today I'd like to open up talking about the femoral sheath and femoral hernias. The extension of the transversalis fascia and iliacus fascia enters the thigh deep to the inguinal ligament. It is divided into three compartments from lateral to medial, which enclose the femoral artery, femoral vein, and femoral canal. Moving on, I want to go into deeper detail about the femoral hernia. A femoral hernia extends through the femoral ring into the femoral canal, resulting in a swelling in the upper thigh that is located inferior and lateral to the pubic tubercle. The hernial sac might protrude through the saphenous hiatus into the superficial fascia. Femoral hernias are more common in females and pose a risk of strangulation due to the potential for the hernial sac to become trapped. During surgical repair, care must be taken as the aberrant obturator artery can be at risk. Moving on. Next, let's talk about the rupture of the Achilles tendon and triceps surae muscle. Avulsion, or rupture of the calcaneal Achilles tendon, leads to impairment of the triceps surae muscle, comprising the gastrocnemius and soleus muscles, resulting in the inability of the patient to perform plantar flexion of the foot. The triceps surae muscle consists of two heads of the gastrocnemius muscle, one head of the soleus muscle, and the plantaris muscle. It typically features a small fusiform belly with a long tendon, which may be occasionally absent and can sometimes undergo hypertrophy. Let's go ahead and check out some questions now. Which structure enters the thigh deep to the inguinal ligament, divided into three compartments, enclosing the femoral artery, femoral vein, and femoral canal, respectively? Alright, I think I gave you guys enough time here. Let's go ahead and move on. If you need more time, please feel free to pause the video. The description provided in the question matches the anatomical features of a femoral hernia. Femoral hernias arise when abdominal contents protrude through the weak area of the femoral canal, which lies deep to the inguinal ligament. This canal is divided into three compartments from lateral to medial, which enclose the femoral artery, femoral vein, and femoral canal itself. Therefore, a femoral hernia is the correct answer. Correct answer, E, femoral hernia. Moving on to see why the other answer choices were wrong. Iliacus muscle. The iliacus muscle is a primary flexor of the hip joint and does not enter the thigh deep to the inguinal ligament. Femoral nerve. While the femoral nerve does pass beneath the inguinal ligament, it does not enter the thigh deep to the inguinal ligament, nor does it traverse the femoral canal. Rectus abdominis muscle. The rectus abdominis muscle is an anterior abdominal muscle and does not enter the thigh or traverse the femoral canal. Transversus abdominis muscle. The transversus abdominis muscle is also an abdominal muscle and does not enter the thigh or transverse the femoral canal. Moving on. A patient presents with difficulty in climbing stairs and rising from a seated position. Examination reveals weakness in hip extension. Which of the following nerve injuries is most likely responsible for this presentation? All right, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. Injury to the inferior gluteal nerve typically results in weakness of the gluteus maximus muscle, which is responsible for hip extension. This weakness is most noticeable during activities such as climbing stairs or standing from a seated position consistent with the patient's presentation. Therefore, the correct answer is B, inferior gluteal nerve injury. Moving on to see why the other answer choices were wrong. Superior gluteal nerve injury. The superior gluteal nerve innervates the gluteus medius and gluteus minimus muscles, primarily involved in hip abduction. Injury to this nerve would not result in weakness and hip extension as described in the patient's presentation. Femoral nerve injury. The femoral nerve innervates the anterior thigh muscles, primarily responsible for hip flexion and knee extension. Injury to this nerve would not result in weakness and hip extension as described in the patient's presentation. Obturator nerve injury. The obturator nerve innervates the muscles of the medial thigh, primarily involved in thigh adduction. Injury to this nerve would not result in weakness and hip extension as described in the patient's presentation. Sciatic nerve injury. The sciatic nerve innervates the muscles of the posterior thigh and lower leg, including the hamstrings responsible for hip extension and knee flexion. However, injury to the sciatic nerve would typically result in weakness or paralysis of both hip extension and knee flexion, rather than isolated weakness in hip extension. Therefore, is less likely to be responsible for the patient's presentation. Moving on to the next question. Which muscle group is primarily responsible for plantar flexion of the foot and becomes impaired in cases of avulsion or rupture of the calcaneal Achilles tendon? Pretty straightforward first order question, so I think I'm just going to move on now. If you guys need more time, please feel free to pause the video. Moving on now. The description provided in the question matches the characteristics of the triceps surae muscle group. Avulsion or rupture of the calcaneal Achilles tendon leads to impairment of the triceps surae compromising plantar flexion of the foot. The triceps surae muscle group comprises the gastrocnemius and soleus muscles, along with the plantaris muscle. Therefore, triceps surae is the correct answer. C, triceps surae, correct answer. Moving on to see why the other answer choices are incorrect. Quadriceps femoris. The quadriceps femoris muscles are located in the anterior thigh and primarily responsible for knee extension, not plantar flexion of the foot. Hamstring muscles. The hamstring muscles are located in the posterior thigh and primarily responsible for knee flexion and hip extension, not plantar flexion of the foot. Tibialis anterior. The tibialis anterior muscle is located in the anterior compartment of the leg and primarily responsible for dorsiflexion of the foot, not plantar flexion. Gluteus maximus. The gluteus maximus muscle is located in the buttock region and primarily responsible for hip extension, not plantar flexion of the foot. That will do it all for today's video. If you have any questions, comments, or concerns, please feel free to leave them in the comment section below. If not, would appreciate it if you could like and potentially subscribe to the channel for more content like this. Otherwise, this is FixerMed signing off. Be sure to have a good day and good luck studying, guys.